many men quietly wonder, is it really okay to ejaculate every day? This question, though often left unspoken, crosses the minds of men from all walks of life. It's a classic curiosity, blending personal health, cultural beliefs, and a desire for honest answers. Even in today's world of easy information, reliable insights about daily ejaculation remain surprisingly elusive, fueling a search for the truth. Conversations about this subject are sometimes met with awkwardness or embarrassment, but the underlying need for clarity never disappears. The frequency of ejaculation is not just about physical release, it's a lens through which bigger questions of men's health, emotional balance, and even long-term well-being are explored. From online forums to medical consultations, the debate continues. Does frequent ejaculation make a meaningful impact, or is it simply a natural part of life? Motivations for seeking answers are as diverse as men themselves. Some hope to optimize their sexual wellness, boost fertility, or prevent health concerns, while others just want to be reassured that their habits are typical. The noise of mixed opinions, outdated myths, and social pressures can make it hard to know what advice to trust. That's exactly why a straightforward, science-based explanation is so valuable. This video takes a step-by-step approach to demystify the effects of daily ejaculation using the latest research and medical perspectives. Viewers will uncover what actually happens in the body and mind, separating useful facts from misinformation. The journey will reveal how individual circumstances, age, health, lifestyle, shape personal experiences, leaving viewers empowered to make confident choices. It's natural to be curious and even concerned about this topic, but open discussion is the first step toward clarity. The aim is to break through the confusion with reason, evidence, and common sense. If you're interested in genuine answers, follow the channel for more conversations like this. Ejaculation represents a remarkable interplay between the brain, nervous system, and reproductive organs. What might seem like a simple act is actually the result of synchronized signals that start in the mind and travel through the body, activating muscles and glands in perfect coordination. When climax arrives, powerful muscle contractions deliver semen, rich in sperm and nutrients, out of the body, fulfilling both biological and evolutionary functions. Across different life stages, patterns of ejaculation vary widely. Young men typically experience more frequent urges and opportunities, sometimes ejaculating daily or multiple times per week. As men progress through their 30s and into older adulthood, changes in hormones and priorities naturally lead to less frequent activity. Despite these trends, there is no single correct frequency. What's healthy differs from person to person. Numerous elements influence these patterns, not just age. Daily stress, relationship status, cultural expectations, and even privacy levels shape sexual routines. For some, periods of abstinence are intentional and meaningful. For others, regular or daily ejaculation fits seamlessly into their lifestyle and emotional needs. All of these choices fall within the broad spectrum of normal male behavior. From a medical perspective, ejaculation is essential not only for reproduction but also for maintaining the health of the reproductive system. Each time, the process clears old seminal fluid and supports the ongoing renewal of sperm. This routine turnover is one reason why health professionals emphasize the importance of regular sexual function as part of overall well-being. The body's ability to manage such a complex event repeatedly highlights its adaptability. The nervous system, with its intricate feedback loops, ensures that each ejaculation is a distinct, controlled response, demonstrating the remarkable efficiency of human physiology. These details lay the groundwork for understanding how habits around ejaculation might interact with broader aspects of men's health. With the foundation set, it's essential to explore what happens at a hormonal and neurochemical level. How do the brain and body react immediately and over time? The next segment investigates these internal shifts and what they mean for everyday energy and emotional stability. Each ejaculation sets off a rapid sequence of hormonal and neurochemical events. In the moments following orgasm, dopamine levels peak, bringing a rush of pleasure and satisfaction. Almost simultaneously, oxytocin is released, encouraging feelings of calmness and sometimes deeper emotional connection, even during solitary experiences. Prolactin rises as well, which is largely responsible for the sense of relaxation or even temporary tiredness that often follows climax. These changes create the familiar afterglow that many men experience, a mixture of physical ease, mental clarity, and contentment. This physiological reset can help manage daily stress and support a stable mood, which is why many report improved focus or reduced anxiety after sexual activity. It's a natural, built-in way for the body to balance stimulation and recovery. A common misconception is that frequent ejaculation might drain testosterone or other vital hormones, undermining long-term vitality. However, clinical research consistently demonstrates that while a minor dip in testosterone occurs right after orgasm, levels rebound swiftly. Over weeks or months, even daily ejaculation has little to no measurable impact on baseline testosterone or overall hormone health. The body's resilience in this area highlights its evolutionary design. These hormonal cycles are meant to handle regular sexual activity without causing depletion. Most men find that their energy, libido, and overall well-being remain steady, regardless of their chosen frequency. Of course, individual differences matter. Some may notice brief changes in mood or energy, particularly if underlying stress is high or sleep is lacking. Still, for the vast majority, these hormonal effects are short-lived and rarely disruptive. They represent the body's adaptive capacity, not a warning sign of imbalance. Armed with a better understanding of these immediate responses, it's logical to consider the broader physical implications. Specifically, how does ejaculation frequency relate to prostate health and the prevention of disease? That important topic is up next. The frequency of ejaculation has become a focal point in discussions about long-term prostate wellness. Multiple studies have drawn connections between regular ejaculation and a lower risk of prostate cancer, especially as men get older. Data suggests that men in their 40s and 50s who ejaculate more than 20 times per month may enjoy measurable protective effects compared to those with less frequent sexual activity. Why might this be the case? The prostate's primary role is producing and storing seminal fluid, which, if not regularly expelled, can accumulate metabolic byproducts and dead cells. Routine ejaculation helps keep these fluids moving, supporting the theory that clearing out the system may reduce the chances of cellular changes that can lead to disease. This biological maintenance is thought to be one of the factors behind lower cancer rates in sexually active men. However, it's important to recognize that this link is not the only determinant of prostate health. Genetics, diet, exercise, and environmental factors all play significant roles. Ejaculation frequency is simply one aspect among many that influence a man's risk profile. Still, the evidence points toward regular sexual activity as either neutral or beneficial, with very little downside for most men. Aside from cancer prevention, ejaculation itself enhances circulation in the prostate and surrounding tissues, which may help prevent stagnation and reduce the risk of chronic inflammation. Some urologists even recommend maintaining regular sexual activity as part of a holistic approach to prostate care. Of course, every man's situation is unique. Those experiencing symptoms such as pain, urinary difficulties, or blood in semen should consult a healthcare provider without delay. Early evaluation is always the best strategy for managing prostate concerns. Join the Members Club and leave a super like if you value honest, science-driven discussions about male health. Next, let's break down the effects of daily ejaculation on sperm production, fertility, and what these changes really mean for reproductive health. Frequent ejaculation often sparks questions about its impact on sperm quality and a man's ability to father children. When ejaculation happens daily, the body has less time to accumulate sperm between releases, which usually leads to a slight drop in sperm count per ejaculate. However, research finds that sperm motility, the ability of sperm to swim effectively, and shape generally remains stable, even with higher frequency. For men actively trying to conceive, this can seem counterintuitive. Yet, studies reveal that more frequent ejaculation may actually help maintain the health of sperm, reducing exposure to toxins and oxidative stress that can build up in the reproductive tract. Fertility specialists sometimes suggest regular, but not excessive, ejaculation, such as every 1 or 2 days, to maximize chances of conception without sacrificing sperm quality. It's crucial to distinguish between sperm count in a single sample and actual fertility outcomes. Daily ejaculation rarely causes any meaningful decline in a man's long-term reproductive potential. Most healthy men can maintain normal fertility, as the body rapidly adapts to changes in demand, restoring both sperm count and ejaculate volume after short periods of abstinence. Noticing changes in the amount or consistency of semen is common when ejaculation is frequent. These shifts are typically harmless and reverse quickly, serving as the body's natural feedback mechanism. Adjusting frequency or allowing for rest days usually resolves any concerns. Broader lifestyle factors, diet, sleep, stress management, have a much larger effect on fertility than the specific number of days between ejaculations. If conception is taking longer than expected, consulting a healthcare provider can provide tailored insights and reassurance. Now, with the reproductive aspects explored, let's shift focus to mental health and mood. How does daily ejaculation influence emotional well-being, and what are the psychological pros and cons to consider? That's coming up next. Sexual activity, including daily ejaculation, often plays a significant role in emotional balance and stress management. Many men find that the act of release provides a sense of relief, thanks to the endorphins and other mood-enhancing chemicals that flood the brain. These natural responses can offer a quick reset after challenging days, contributing to feelings of relaxation and emotional stability. Beyond immediate comfort, regular sexual release may help regulate emotional ups and downs. Dopamine and oxytocin, released during orgasm, deliver temporary boosts in mood and can even promote feelings of connection, even when the experience is solitary. For some, this ritual becomes a tool for maintaining a consistent emotional baseline. Nevertheless, it's worth considering the potential downsides. A small number of men report feeling drained or briefly unmotivated after frequent ejaculation, a phenomenon likely tied to the temporary surge in prolactin. While most recover quickly, this effect can become more noticeable if other wellness habits, like sleep and exercise, are neglected. Another aspect is the risk of turning daily ejaculation into a compulsive or escapist behavior. When sexual activity becomes a substitute for dealing with emotional challenges, it can foster guilt or anxiety. Recognizing one's motivations and ensuring a balanced approach helps prevent these patterns from taking hold. Cultural messages and personal beliefs often color the psychological experience as well. Some men may feel liberated by their routine, while others struggle with lingering stigma or mixed emotions. Open dialogue, whether through self-reflection or professional support, can help resolve internal conflicts and foster a healthier outlook. With the emotional landscape in mind, let's move to the physical side. Specifically, what sensations and myths surround daily ejaculation. The following segment separates fact from fiction regarding physical effects and long-standing misconceptions. Daily ejaculation brings with it a mix of normal bodily sensations and a host of myths that have circulated for generations. On the physical side, some men notice increased sensitivity right after orgasm, mild soreness, or a reduction in semen volume if ejaculation happens repeatedly over short periods. These sensations are the body's way of signaling the need for recovery and typically resolve with short breaks. Worries about long-term sexual function often arise, yet the medical consensus is reassuring. Frequent ejaculation does not cause erectile dysfunction or permanent changes to sexual ability for healthy men. In many cases, staying sexually active helps maintain responsiveness and supports pelvic health over time. Misconceptions abound. Claims that masturbation causes hair loss, weakens eyesight, or leads to impotence persist in some circles. Science has thoroughly debunked these ideas. No credible research supports the notion that daily ejaculation damages physical health or reduces a man's vitality in any way. Such beliefs are rooted in outdated taboos, not medical fact. Some may observe temporary shifts in semen color, thickness, or volume. These variations are harmless and often reflect normal fluctuations in hydration or frequency. After a brief rest period, the body quickly restores usual patterns, and there's no lasting effect on reproductive health. Occasional feelings of tiredness can accompany high-frequency sexual activity, especially if combined with lack of sleep or poor nutrition. However, there is no evidence that ejaculation uses up essential energy or weakens the immune system. Moderation and self-awareness are the keys to avoiding discomfort. With the facts in hand, it's clear that most physical concerns are either manageable or unfounded. Next, let's examine how age, health status, and personal differences shape the experience of daily ejaculation, and when it may be wise to consult a professional for advice. Each man's response to daily ejaculation is unique, shaped by age, medical history, and personal habits. Younger men typically recover quickly and may experience minimal side effects from frequent sexual activity. As men approach middle age and beyond, natural changes in hormone levels, energy, and libido can influence both desire and recovery time, making individual adjustments more important. Chronic health conditions add another layer of complexity. Men with heart disease, diabetes, or neurological disorders may notice differences in stamina, sensation, or satisfaction compared to earlier years. Medications prescribed for these conditions can also impact sexual function, underscoring the need for a personalized approach to routine and frequency. When symptoms such as pelvic pain, inflammation, or persistent changes in sexual function arise, it's wise to take a pause and consult a healthcare professional. Ignoring discomfort can delay diagnosis of issues like prostatitis or erectile dysfunction, conditions that often respond well to early intervention and treatment. Emotional well-being and relationship context matter, too. High-stress relationship conflict or anxiety about performance may affect how often a man feels comfortable or motivated to ejaculate. Open conversations with partners and a willingness to adapt habits can go a long way in supporting mutual satisfaction and emotional health. Cultural norms and expectations play a subtle but powerful role. Societal messages about masculinity and sexual normalcy may fuel guilt or confusion. Embracing personal comfort and well-informed choices helps break free from unnecessary pressure and supports healthier attitudes towards sexuality. Join the Members Club and leave a super like if you appreciate honest, evidence-based discussions about men's sexual wellness. Up next, discover practical tips for choosing the right frequency, building positive habits, and knowing when it's time to seek outside guidance. Choosing the ideal frequency for ejaculation is a personal decision, best guided by self-awareness and overall well-being. For most healthy men, daily ejaculation is safe if it fits comfortably into their lifestyle and doesn't interfere with work, relationships, or sense of balance. Paying attention to physical cues, such as sustained fatigue or declining interest, can help determine when it might be time to slow down or adjust habits. Establishing positive routines goes far beyond counting days. Good nutrition, exercise, restful sleep, and stress management form the foundation for sexual and reproductive health. Discussing concerns openly with partners or a healthcare professional encourages confidence and dispels lingering doubts. Education and honest conversation are vital for keeping sexual wellness free from shame or misinformation. For those aiming to improve fertility, slightly spacing out ejaculations may boost sperm count per sample, but most research suggests that regular, frequent ejaculation does not harm chances of conception in healthy individuals. Broader lifestyle factors, like avoiding toxins and supporting overall health, often matter far more than strict adherence to a schedule. Mental and emotional factors are just as important. If sexual habits start to feel compulsive or bring discomfort, seeking support from a counselor or medical provider can make a world of difference. Addressing these issues early helps prevent unnecessary stress or guilt and keeps sexual health positive and enjoyable. As life circumstances change, so too should sexual routines. Flexibility and self-compassion make it easier to adapt habits without feeling pressured or judged. Embracing change as a normal part of life supports long-term wellness and satisfaction. Join the Members Club, drop a super like, follow the channel, and leave a comment sharing your perspective or questions. In our final section, We'll recap the essential lessons, highlighting the safety, benefits, and when to reach out for personalized guidance about sexual health. The question of whether daily ejaculation is safe or beneficial is more than just a curiosity. It touches on core issues of men's health, well-being, and confidence. Scientific evidence consistently shows that, for most men, regular ejaculation does not pose risks and may even support prostate health, emotional balance, and a positive outlook on sexuality. Any short-term changes in semen volume or sensitivity are minor, temporary, and rarely cause for concern. Understanding how the body manages hormonal shifts and recovers after sexual activity helps dispel many of the fears and myths that persist. Rather than worrying about exact numbers, men are better served by listening to their bodies, making adjustments as needed, and focusing on total well-being. Age, health conditions, and individual circumstances all shape what healthy means on a personal level. Still, it's crucial to be mindful of signs that deserve medical attention. Ongoing discomfort, changes in sexual function, or any symptoms that cause worry should prompt a visit to a healthcare professional. Individualized advice is always the best approach, especially as health needs evolve. Creating space for open conversations about sexuality empowers men to make informed decisions without shame or confusion. Whether seeking to enhance fertility, manage stress, or simply enjoy life, informed choices and flexibility are the true keys to lifelong wellness. Remember, every man's journey with sexual health is unique, and adjusting habits as life changes is both normal and healthy. The foundation of good sexual health is knowledge, self-awareness, and the willingness to ask questions when needed. Consult a healthcare professional for tailored advice, and always prioritize your own well-being first.